All right, today we are digging into an absolutely incredible story. One about a drug that really truly changed modern medicine forever. It's a wild ride, full of desperation, a bit of international intrigue, and, believe it or not, a life-saving molecule found in just a handful of dirt. Let's get into it.
So picture this, it's the late 1980s. An organ transplantation, well, it's hitting a wall. A huge one. The big drug at the time, cyclosporine, which had been a game changer, had kind of reached its limit. I mean, patients were dying, new organs were failing, and doctors were just running out of options. It was a really grim time.
But here's the crazy part. The solution, the answer they were all so desperate for, wasn't being cooked up in some high-tech lab. Nope. It was just waiting. Quietly in a fermentation flask, a secret kept by a tiny microbe found at the base of a mountain in Japan.
Okay, so to really get why this was such a revolution, we have to go back. We have to understand the crisis that made it so desperately needed. This is the era of the yellow wards, a place where hope was really on the line.
You see, cyclosporine had made organ transplants a real possibility, but man, it was a deal with the devil. It came with these awful toxic side effects, and a lot of the time, it just couldn't stop the body from slowly rejecting the new organ. So you have these ICUs filled with patients who were literally yellow from jaundice because their new livers were failing. Their bodies were just being overwhelmed by the very drugs that were supposed to save them.
All right, now let's jump halfway across the world, over to Japan. Because while surgeons in the US were fighting this losing battle in the yellow wards, a pharmaceutical company was sifting through soil samples, and they were about to strike medical gold. This is the story of the molecule from Tsukuba.
So back in 1984, researchers at a company called Fujisawa Pharmaceuticals isolated this totally new compound. They found it in a bacterium from the soil, which they named Streptomyces tsukubaensis, named right after Mount Tsukuba where they found it. Its super scientific code name was FR900506, but the world would soon come to know it as Tacrolimus.
And this is the part that is just mind-blowing. When they tested this new molecule, they found it was almost 100 times more powerful at suppressing the immune system than cyclosporine. 100 times. This wasn't just an improvement, it was a potential game changer on a scale they could barely imagine. But of course, there was a catch. A huge one. Because of this really restrictive trade agreement between the Japanese company Fujisawa and a British firm, Thyssen, this miracle molecule was basically on lockdown. For researchers in the US, it was like a ghost, just a rumor they couldn't get their hands on. And this is where the story pivots, you know? It stops being about labs and molecules and becomes about sheer human will. With a potential cure locked away behind corporate red tape, a small group of surgeons decided they just weren't going to take no for an answer. This was their quest for a cure, their negotiation for a miracle.
And our main character here is Dr. Thomas Starzl. He was a legendary transplant surgeon in Pittsburgh, and he was the one watching his patients die in those yellow wards every day. So when he starts hearing whispers of this new Japanese molecule, his ears perk up. He's immediately hooked.
Now, what makes this so interesting is that there was a major voice of caution, and that voice belonged to Sir Roy Kane, another giant in the transplant world. His early tests on dogs showed some pretty severe toxicity, which led a lot of people to write the drug off as just too dangerous for humans. And that skepticism, it caused a 3-year delay. 3 critical years.
So how did they break this stalemate? The key, the absolute linchpin, was Dr. Satoru Todo. He was a Japanese surgeon working on Starzl's team in Pittsburgh, and he was the perfect bridge. He didn't just speak the language, he understood the culture and the science. He was the one who could build that essential trust between the American team and the very conservative leadership at Fujisawa.
So, for 3 long years, from 1986 all the way to 1989, Starzl just fought to get his hands on this drug. Every official request failed. Every conventional channel was a dead end. Finally, he and Todo decided to do something pretty radical. They got on a plane and flew to Japan to make their case in person. It was like a pilgrimage.
And this little detail just perfectly captures the human side of this whole saga. While they were in Japan, kind of stuck in this waiting game, Starzl had his 60th birthday. His Japanese host threw him a traditional kanreki ceremony. Now, in Japanese culture, turning 60 isn't about getting old, it's a symbol of rebirth, of starting a brand new life cycle. I mean, could there be a more perfect symbol for what was about to happen to the entire field of transplantation?
At last, after that personal trip and some really intense negotiations, Fujisawa agreed. They sent a tiny amount of the drug to Pittsburgh, barely enough to fill a thimble. The stage was finally set for what they called Day Zero. the day of the very first patient.
That day was March 1st, 1989. A 26-year-old woman named Robin Ford became the first human being to ever receive tacrolimus. Her situation was desperate. She was rejecting her third liver transplant. For her, and for the doctors, this was literally the last hope.
So how does this stuff even work? Well, it's actually beautiful in its simplicity. Tacrolimus gets inside the body's T cells. Think of them as the soldiers of your immune system. Once inside, it grabs onto a protein, and together they form this new complex that basically shuts down a key enzyme called calcineurin. By blocking that enzyme, it stops the T cell from ever getting the attack order, the immune system's assault on the new organ. It just grinds to a halt.
And the results were, well, they were immediate, and they were miraculous. This chart shows what happened to Robin Ford's bilirubin levels. That's a key marker for liver failure. Before tacrolimus, you can see they were sky high, super dangerous. Afterwards, they just plummeted. Her skin color returned to normal. The drug wasn't just working, it was a home run.
But that one incredible success story wasn't just about saving one patient. It blew the doors wide open. This was the dawn of a whole new era in medicine, the beginning of the legacy of that little molecule from the soil.
Now, a single miracle is amazing, but it's not enough to change all of medicine. For that, you need hard data. You need proof. And that's where Dr. John Fung comes into the picture. He became what you could call the architect of evidence. He's the one who ran the massive, rigorous clinical trials that proved, beyond any doubt, just how much better this new drug really was.
And wow, did the numbers tell a story. Just look at the results from the big Pittsburgh trial. With tacrolimus, you had about a 90% one-year survival rate for the new organ. For cyclosporine, it was closer to 80%. But look at this other number. This is what really blew people away. A whopping 70% of the tacrolimus patients were able to get off steroids completely. That was huge for their quality of life.
So the legacy is just profound. Tacrolimus became the global gold standard for preventing organ rejection. It made procedures that were once considered impossible, like intestinal transplants, a real option for patients. And it really did transform transplantation from this heroic last-ditch experiment into a reliable, almost routine therapy. It was approved for liver transplants in '94, then kidney, then heart, and as recently as 2021 for lung transplants too.
It's just such an amazing story, isn't it? A story of persistence, of science, of cross-cultural teamwork. A journey that started with a bit of Japanese soil and ended up at the absolute pinnacle of modern medicine. And it really makes you wonder, doesn't it? What other revolutions, what other miracles are just waiting to be discovered in the soil right beneath our feet?